So respiratory infection, this is not in the textbook, okay, just for your knowledge. Some nutritional consideration also regarding respiratory infection. Now some strain of coronavirus is back somewhere, so be careful. So this chapter should give you some insight regarding what to take care of, okay. Respiratory infections. What is a respiratory infection? A respiratory tract infection affects the respiratory system, the part of your body that is responsible for breathing. Okay, these infections can affect your sinuses. Sinuses are hollows in your skull. Okay, in your skull bone, there are certain hollow spaces. These are your sinuses. And because these are air filled, these are hollow spaces filled of air. And because of this, you can't feel the weight of your skull and the brain. Okay. So sinuses should be empty. Sinuses should be empty, and also it should not be filled with fluid. If it is filled with fluid, means you are suffering from some respiratory infection. Okay. And there are two types of respiratory infection, and the infections that whatever happens, it will definitely affect your sinuses. It will fill your sinuses with fluid. Instead of air, it gets filled with fluid. Okay. So upper respiratory tract infection and lower respiratory infection. Okay, you can see a view of respiratory system from the nostrils up till the lungs. Okay, till the larynx, it is the upper respiratory tract. From the trachea onwards, after larynx, from the trachea onwards, trachea, bronchi, lungs, they come under lower respiratory tract. All the nasal cavity, your nose, nasal cavity, pharynx, larynx come under the upper respiratory tract. So what is upper respiratory tract infection? These infections affect your sinuses and throat. Okay, the upper respiratory infections include common cold, epiglottitis, laryngitis, pharyngitis, sinusitis. Common cold is the infection caused by rhinovirus. Okay. Epiglottitis, your epiglottis just above the larynx. Okay. Epiglot is kind of a triangular structure that closes your trachea while you are swallowing something. So when you're drinking water, swallowing food, epiglot is a structure. It's a triangle kind of structure that closes your trachea so that the food or water does not go into the trachea and cause aspiration. Okay. So if that gets inflamed, it is called epiglottitis. Then you have laryngitis, pharyngitis is sore throat, sinusitis, sinus infection. Sinus will get filled with fluid instead of being filled with air. Okay. Lower respiratory tract infection, it affects the airways. Okay, airways is laryngitis. Larynx will get inflammation. Larynx is the sound box. Okay, just above your trachea. So the lower respiratory infection, it affects the airway and lungs. In general, lower respiratory infections can last longer and they're more serious because they form mucus. The fluid that is filled in the alveoli, they have to travel back into the bronchi, bronchus, trachea, and they have to be coughed out from the system. So it takes much longer for you to recover from lower respiratory tract infection. Okay, like bronchitis, it's a liver lung infection that causes coughing and fever because while coughing, the mucus that is formed here, excess mucus as a response to inflammation, excess mucus and fluid, they get filled in the lungs. They have to be coughed out. Okay, villi are there. Villi are microscopic finger-like structure in your trachea and your bronchus. They will shift this extra mucus upwards towards the upper respiratory tract system so that you can cough it out. Okay. Then bronchiolitis, usually happens in young children. Bronchioles, okay, these are the small branches of bronchi. Okay, these are the bronchioles, the smallest branch of the bronchi. Okay, so that gets inflamed. That happens in young children. chest infection, pneumonia. Pneumonia is also a lung infection where inflammation will take place in the alveoli. Alveoli is supposed to be filled with air. Okay, alveoli are these balloon-like sac structures. They fill up with air. Okay, and when they fill up with fluid instead of air, you get pneumonia. Okay, 1 minute. Am I audible to all? Is my screen visible? Am I audible? So that's about lower respiratory tract infection till pneumonia. So what causes upper respiratory tract infection? You get an upper respiratory tract infection when a virus or bacteria enters your respiratory system. Okay, that's when you get upper respiratory tract infection. It could be viral, bacterial, fungal as well. Okay, sometimes when you touch an infected surface or shake hands with a person who is sick and then touch yourself, your nose, mouth, that the germs can transfer, okay, from direct contact and also via droplet. Okay, droplet infection I will explain you later. So via direct contact and also via droplet, the infection can be transmitted from one person to another. Okay. So it could be viral infection, like common cold is a viral infection. It's not a bacterial infection. Okay. Rhinovirus is the causative agent. Asthma is a lower respiratory tract infection because in asthma, your your bronchis, okay, trachea, bronchi are involved. In asthma, what happens is that, and it's not an infection. Asthma is not an infection. It's a reaction to your body, okay, to certain allergens. So in asthma, what happens is that the passage that air has, air passage, it gets constricted. Tracheas get swollen up, your bronchi get swollen up, and there is very less passage left for the air to actually go into your lungs. Okay. Droplet infection is the ones conjunctivitis. Okay, that is an infection that can be transmitted through the tears in the eyes. Okay. So causes could be viral infection, bacterial infection, fungal infection, allergies such as hay fever, nasal polyps. Those who have nasal polyps, when you look into your nostrils using a flashlight, you will see a mass. Usually, you will find a mass on the right nostril. Okay, nasal polyps is very common on the inside your inside your right nostril. Okay. Acid reflux, not acid reflux, aspiration. Okay, not acid reflux as such. Aspiration can lead to lower respiratory tract infection, not upper. Aspiration means the food or drinks that are supposed to go into the esophagus, food pipe, they go into the windpipe, into the and they get stuck in the lungs, and that give rise to pneumonia or infection. Deviated nasal septum. Nasal polyps are not required to be removed until it becomes constrictive. Okay, it constricts your nostrils completely. It gets so swollen up, and it will constrict your nose completely. In that situation only nasal polyps are removed. Otherwise, if they are harmless, no need to remove nasal polyps. Okay, only when you're not even able to breathe properly because of this obstruction of polyps. Okay, in such situation, it's our advice to surgically remove the polyps. Okay. Deviated nasal septum, your the nose bridge. Okay, if the nose bridge is not straight, you can do a self analysis also. Like when you touch the tip of your nose, you press it slightly and see where the tip of the entire nose goes. Is it going to the right direction or the left direction? Usually in a deviated nasal septum, when you press the tip of your nose, if the nose bridge goes into any one direction, it means you have a deviated nasal septum, DNS. Okay. Otherwise, if you're having a straight nasal septum, the nose bridge will not go anywhere. It will just get pressed down. Okay. So these are the causes in which frequently you may get an upper respiratory tract infection. So who is at risk for upper respiratory tract infection? Anyone can catch it. Okay, but certain group of people are at higher risk as compared to others. Like children are at high risk since they often play with other children who may be carrying the viruses. They always want to be out, they want to socialize, they want to go out with friends, and also they interact more with other adults and other children. Okay, so they are at high risk. Children also, they don't wash their hands. They don't have the awareness to always wash their hands when they come back home, wash themselves, wash their hands before eating. Okay, until and unless an adult scolds them or reminds them, they will not do this. Okay. So that is one of the reasons why children are at higher risk. People who have heart or lung problems, or even generally people who have a weak immune system because of another disease, they are suffering from some other infection, so immunity is compromised, and in that compromised situation, they may acquire new infection as well. Okay, so these are the people who are at risk of upper respiratory tract infections. So how are it diagnosed? Usually, you don't require major tests to diagnose upper respiratory tract infection. Usually, when you go to a hospital or a doctor, they will do your physical examination, see your symptoms. They will look inside the nose, ears. Okay, ENT check will be done. Okay, and they will see your breathing. They will ask you using stethoscope. They will see your breathing if there is any obstruction or not, and with that, it is diagnosed. Other test is usually not required. Okay, but if after checking your breathing, okay, if the provider wants to rule out any lung infection, okay, uh, in such cases, chest X-ray may be required. CT scan, lung CT scan may be required. Okay, pulmonary function test, PFT, can be done to see what is the capacity of your lungs. Okay, what is the capacity of oxygen capacity of your lungs? That can be checked with PFT test. Nasal swab for any infection. Throat swab again to rule out any infection. Sputum test to rule out TB or other infections. When you cough up some sputum, it can be sent for examination. So sputum test can be done. Only when the doctor is concerned that it is not just an upper respiratory tract infection, there is something more and some obstruction they must have felt while checking your breathing using stethoscope. Okay, so you only in such situation these tests could be prescribed. So upper respiratory tract infections are contagious. It means it will pass from one person to another through droplets or hand-to-hand contact. So direct contact is also one way of transmission. Droplet transmission also takes place. Okay, droplet transmission means if you are in the same room, you may not get sick, but if you come anywhere close to 5 feet, okay, 4 to 5 feet, if you come close to the person who is infected, you may get sick, you may get the disease. Okay, and if you're taking care of the patient, the person who is sick, okay, who is already having infection, you're taking care of them, you're going very near to them. Okay, in such cases droplet infection can spread. Even conjunctivitis is a droplet infection. It can spread through sweat, nasal droplets, okay, sneeze and cough. Why? Because the microorganisms which infect and cause droplet transmission, they are heavier. Okay, they are heavier in size. They are larger than 5 uh, microns in size. So what happens is that whenever a person is coughing and sneezing, definitely they are propelling out the microorganisms through their cough and sneeze. But since because of the weight of this organism, these viruses and bacteria in the cough and sneeze, which is heavier, they can't be propelled far away. Okay, air currents can't take it from one place to another. They're not that light, they're heavier. So they settle down very close to wherever the patient is sitting, lying, or resting. Okay, usually a 4 feet radius or a 5 feet radius around the patient is an infected zone. Anyone who comes within that zone should wear a mask and come. If you're in the same room, but if the patient is, let's say, 10 feet away from you, you are safe, nothing will happen to you. Okay, if you're 10 feet away from the patient in the same room, nothing will happen to you. The infection cannot come till you until you touch the patient or touch anything that the patient has touched. Okay, so that is droplet transmission. So people who have upper respiratory tract infection can pass it to others through sneezing and coughing without covering their nose and mouth. Okay, they can spray germs into the air, and other people who breathe those germs, they can get infected. Sneezing or coughing into the hand and then touching someone else's hand. Okay, if you don't use a mask or a handkerchief, you use your hand to sneeze or cough, and then without hand washing or without sanitizing your hand, you go and touch somebody else, you're transmitting the infection to them. What are the symptoms of upper respiratory tract infection? You will definitely have cough, fever. Okay, slightly your temperature will rise. In any infection, your temperature will rise. Hoarse voice. Okay, your voice will change. It will become very heavy and hoarse. Hoarse means rough. Okay, fatigue, lack of energy, red eyes because of sinusitis and infection, runny nose because of sinusitis, sore throat, swollen lymph nodes around your face, around your jaw, swelling on the sides of your neck. So these are common symptoms of upper respiratory tract infection. And how long does it last? Usually it can last up to 1 or 2 weeks. Most of the time it can go away on its own. If it is common cold and all, within 3 days you will get relief. Okay, over the counter pain medications can also help you feel better. And make sure that you drink a lot of water. So drink a lot of citrus fruit juices. Stay hydrated. And if your symptoms are lasting longer than 2 weeks, that's when you have to consult your doctor. You may have to get checked for any other condition. It could be bronchitis or pneumonia. Okay, if the flu-like symptoms are lasting longer than 2 weeks. Can antibiotics treat upper respiratory tract infection? Most of the time, viruses are the ones who causes upper respiratory tract infection, and viruses will not respond to antibiotics. Only antivirals can take care of viruses. Antibiotics are made only to kill bacteria. Okay. So most likely you have to treat the symptoms at home through pain relievers, rest, and drinking fluids. And if you have any bacterial infection, like throat means streptococcus is a causative agent that is causing infection on your throat. That is strep throat. Okay. Only in that situation, antibiotics like penicillin or amoxicillin can help you. Okay, otherwise, majority of the upper respiratory tract infection, usually it is viral and antibiotics cannot respond. Antibiotics should not be prescribed for common cold and should be considered only for specific secondary bacterial infections such as sinusitis, streptococcal infection, pharyngitis, otitis media, that is ear infection. Okay, otitis, middle ear, will undergo infection. Bronchitis, unnecessarily prescribing the antibiotics will increase the risk of antibiotic resistance. Okay, which means your body will stop responding to antibiotics. The bacteria which is infecting you can overpower and overcome the antibiotics, and you will have to jump higher classes of antibiotics. Okay. Infection, whenever it is an infection like bronchitis or pneumonia, first you have to identify, is it an infection, allergic reaction, any obstruction or not. When you identify it is an infection, which type of infection? Is it viral, fungal, bacterial? Okay, only if it is an bacterial infection, antibiotics can be prescribed. For viral infection, antiviral has to be prescribed. For fungal infection, antifungal has to be prescribed. Okay. If you have any of the following symptoms, contact your healthcare provider or seek medical help. Okay, these are the extremes of respiratory infections. A common cold will not take you to this level. This is some serious infection which is underlying. Okay, if there is a loss of consciousness in the patient, okay, high fever that is higher than 103 degree Fahrenheit. Okay, common cold will usually not, it can slightly increase your temperature. Okay, 99 degree Fahrenheit or 99.8 degree Fahrenheit. Okay, that could be the maximum that common cold can give you. Okay, but the temperature, if it is crossing beyond 103 degree Fahrenheit, it means you are suffering from high fever, and that common cold is not responsible for that. It is something else. Okay, rapid breathing difficulty, frequent and severe coughing, and sometimes coughing with coughing out blood. Okay, sputum with blood, and along with vomiting, sputum is coming out. Okay, so that these are considered as severe coughing. Wheezing, it's a high pitched whistling sound when you breathe out. Usually, if you have seen an asthmatic patient breathe, okay, bronchitis patient or an asthma patient breathe, you will know what a wheezing sound is. Okay, it's like a whistle. It's like a whistle that is not as high pitched as whistle. Okay, it's like a broken whistle. When you try to blow out a broken whistle, what kind of sound it comes? Wheezing is very similar to that. Okay, so when the patient who's asthmatic or who has bronchitis, when they are breathing, they have this wheezing sound to their breath. Okay, dizziness and retractions when you see deeper outline of your rib cage, means you are breathing so far in and breathing out also, so with all your exertion, but when you're breathing in, you take so much strength to breathe in that your rib cage, the outline of your rib cage can be visualized through your skin. Okay, means you are straining a lot to take in, you're gasping for air. Okay, so and this sign is more obvious in children as compared to adults, because adults develop a thicker skin and bigger, thicker fatty and muscle over year, so it is not as visible in adults, but in children it's very visual. You can visualize this retractions. So in that case, immediately take the child to the hospital. Stridor, that's harsh, raspy, vibrating sound or feeling that you get when you breathe. And sometimes it sounds like a seal. Okay, again, it is more common in children as compared to adults. Wheezing usually happens when your trachea or bronchi is undergoing constriction. Okay, there is no enough space for the air to move in and move out of the trachea. It is undergoing constriction. Okay, so immediate help has to be given. Either the patient may have their own inhaler or nebulizer that can give some relief. It can cause the dilation of the trachea. Okay, usually when the trachea gets swollen up and there is no space for the air to reach to the lungs, very little space for the air to reach into the lungs, that's what leads to the wheezing sound. Okay, usually it's a medical emergency. If the patient does not have an inhaler on them, it's a medical emergency. You have to take them to the emergency department. They will start the oxygenation. They will give them the Darifilin or Astalin. Some medication will be given that will dilate the trachea and the bronchi. Okay, within half an hour, relief will come in after medication. The nutritional considerations of upper respiratory tract infection. So diet is a significant modulator of immunity. Certain macro and micronutrients play especially important roles in the immune function, and they have been demonstrated to alter both the risk for upper respiratory tract infection and its duration. Some nutrition, when you focus, it can reduce the time period of your suffering as well. And also, it can reduce your risk of getting the upper respiratory tract infection in the future as well when you focus on some specific nutrients. Okay, we'll see that. Zinc. Zinc ions inhibit rhinoviruses. Rhinoviruses is the causative agent of common cold. Okay, sardi zukam that happens, the causative agent for that is rhinovirus. It's not bacterial, it's viral. Okay, and zinc can inhibit rhinovirus. It can prevent the rhinovirus replication, means few copies of rhinovirus has infected you. If they stay within your body, they will create more copies of this virus, and you may suffer from common cold for an entire 1 week if there is too many copies of virus within your body. So zinc will prevent this replication. Zinc will prevent the virus from copying itself. Okay, and stimulation of T cells. Zinc can help the T cells to get stimulated and go and attack the virus as soon as possible. Okay. One meta-analysis is a major, big research in which the population or the universe used the subjects who came for this research were in huge numbers. Okay. That's meta-analysis. Found that zinc lozenges, that is zinc supplements, reduce the duration of cold by nearly 3 days. Okay. If average is 5 to 6 days for a person to suffer from cold, if the person is taking zinc supplement, it can reduce the suffering by 3 days. Okay. While systemic review found that zinc supplements reduce the duration of colds by 42%. Okay. Fatty acids, omega-3 fatty acids. Studies have found that supplementation of omega-3 fatty acids reduces the incidence of upper respiratory tract infection in infants and children, especially DHA and EPA. They are different forms of omega-3 fatty acids. Vitamin D supplementation. Controlled trials, that are some researchers, has revealed that the ability of vitamin D supplements to significantly reduce the incidence of upper respiratory tract infection, which means if you're deficient in vitamin D, your risk of getting common cold or upper respiratory tract infection is higher. Okay, but if you correct your vitamin D deficiency, your risk will reduce. Yeah, the zinc supplements available over the counter will also do the same. Coming to vitamin C, it's widely accepted that vitamin C can prevent and also treat cold. It's accepted in general population. And evidence also supports the efficacy of mega doses of vitamin C for upper respiratory tract infection. Okay, specifically for people who are under significant physical and environmental stress. Okay, like marathon runners, skiers, soldiers, and people who are exposed to severe cold. If you give them mega doses of vitamin C, it has shown, it has proven that it has an efficacy to reduce the infection. Okay. In these people, the relative risk of developing cold was reduced by 50% when they took vitamin C supplement as compared to the people with risk and who are not using supplements. So that is a proven fact that vitamin C definitely helps in aiding or reducing the duration of common cold and also reducing the incidence of common cold among the risky population. So that's about upper respiratory tract infection and nutritional consideration. If you have